Uh, today, today, the topic of my presentation is hyperemesis, and it is a case presentation. And the sequence of my presentation is as follows. Firstly, the case scenario, then examination, definitions, epidemiology, etiology, and pathophysiology risk factors, classification and severity of nausea, vomiting in of pregnancy, management, discharge, follow-up, and effect in postnatal period. This was the scenario. Mrs. ABC, wife of XYZ, 23 years old, female, homemaker by education. She was PA, resident of Model Town, Lahore, married for 6 months, primary gravida, with last menstrual period on 13th of October 2023, making her expected date of delivery on 19th of July 2024. And her duration of pregnancy on 7th of January was 12 plus 2 weeks. And she presented to labor complaint of excessive vomiting from 1 month and decreased vomiting from 2 weeks. History of presenting illness. It was a spontaneous conception, unplanned pregnancy, confirmed by urine pregnancy test 1 month ago. Patient was taking folic acid previously, but from 1 month she was unable to take folic acid due to nausea and vomiting. There was no history of flu, fever, or rash. There was no history of any vaginal discharge or bleeding. Patient was having nausea and vomiting from 1 month, and the severity increased from last 3 weeks, and she was unable to take any oral intake from last 2 weeks, and she was throwing up what she was eating from last 2 weeks. Because of these nausea and vomiting, she was having disturbed sleep, and her quality of life was affected by this nausea and vomiting. And according to her, her weight is also decreased. And she presented to general physician in last 2 weeks twice, and they gave her oral antiemetics, but the nausea and vomiting was not settled. Her dating scan was not done yet. Her past medical history and surgical history was insignificant. In her family history, her mother was hypertensive. Gynecological history. She was having a regular menstrual cycle. जी सही है. On examination, my patient, a young female of 23 years old, anxious looking, sitting comfortably on bed, well oriented in time and place, person with height of 172.72 centimeter and weight of 55 kgs, making her BMI of 18.4 kilogram per meter square, having pulse of 105 per minute and blood pressure of 100/60 millimeter of mercury. She was afebrile with oxygen saturation at room air 98%. In her general physical examination, she was showing pallor, sunken eyes with dry lips and tongue.
So the points to be emphasized here are that number one, to start with, she has a low BMI. 18.4 is on the lower side, right? But important amongst that is the one you said that she was anxious looking. That is relevant to this history. And secondly, on general physical examination, you said pallor, well, that can be there anyway, but sunken eyes, which shows features of which would mean some kind of dehydration. So dehydration, dry lips and tongue, if that is what you would want to emphasize. So anxious look and sunken eyes and dry lips. The rest, of course, that was not good.
Yes. In the case summary, my patient, 23 years of age, primary gravida at 12 plus 2 weeks, presented with excessive nausea and vomiting, affecting her routine lifestyle. What are your differential diagnosis?
What is the differential diagnosis you would want to tell us, or you want to ask us?
I want to ask the differential diagnosis.
तो आप खुद ही बताओ
So differential diagnosis includes.
So these are the points actually which will be there, that one is differential diagnosis. And the provisional diagnosis, first will be provisional diagnosis and the differential diagnosis would actually come later. And the management of this patient, counseling is part of that management, so counsel and management. So essentially, we are talking of the provisional diagnosis is that it is nausea, vomiting of pregnancy.
Yes.
And what would be the differential diagnosis?
Sir, gastroenteritis, and if she's having pain, cholecystitis or pancreatitis, or
She doesn't have pain. So if she doesn't have pain, you will take into consideration only those possible diagnoses which would fit this presentation.
hepatitis, urinary tract infection or hepatitis.
She doesn't have urinary
No, sir.
symptoms, so why would you bring that in? So that's not relevant. But yes, some liver dysfunction. Liver dysfunction, gastroenteritis. Well, I'm not sure, because gastroenteritis also implies that she would have some frequency of bowel movement and situation like that. But well, we can take that gastroenteritis.
H. pylori infection, which was advised, she was advised by a general.
So gastric
physician.
issues, gastroenteritis and others, and liver dysfunction or causes of vomiting. But of course, our top of the diagnosis would be that. What is the duration of her nausea? Because she is 12 weeks pregnant.
1 month.
1 month.
Severity increase.
So she started having nausea, vomiting when she was around 8 weeks pregnant. So from that time onwards, she has this. All right. Chale ji, aage.
The definition of nausea, vomiting of pregnancy, symptoms of nausea and vomiting during early pregnancy where there are no other causes. Hyperemesis gravidarum is a triad of more than 5% pregnancy weight loss, dehydration, and electrolyte imbalance. 80% of the pregnant women experience nausea, vomiting of pregnancy during pregnancy, and hyperemesis is the severe form of it, which affects 0.3 to 3.6% of pregnant women. Etiology and pathophysiology. Etiology of hyperemesis is unclear, but it suggests
आप
that
इसको इस तरह से बोलोगे, वो तो लिखा हुआ है कि unclear, कि although it is unclear, अब मैं थोड़ा सा बताऊंगा तुम लोगों को बाद में कि क्या है, but there are those hormonal factors, and generally we've been thinking that since beta HCG starts rising, and it presents it in severer forms in those conditions where the level of beta HCG is high. For example, in twin pregnancy, in molar pregnancy, in those the incidence is high, and of course also women who are pregnant for the first time, because they are exposed to, say, beta HCG. I'm going to totally debunk all that what I'm saying right now, because I'm going to tell you something else. But so far we have been thinking of that. So beta HCG was one of the factors, or other pregnancy hormones like rising levels of estrogens.
Yes.
Or and the way the other hormones and pregnancy affect gastrointestinal system. So their effect on gastrointestinal system and genetics. Why do you say genetics?
Sir, if a patient is having family history of
Usually these women have family history of excessive vomiting. So whenever there is something which runs in the family, that of course will point to something in the genes.
There are some meteorological theories which suggest that the hyperemesis is phytoprotective for some teratogenic agents.
Protectiveness वालों की कारण ये वो पता नहीं protective ही है.
जी सर.
अच्छा, मुझे लगता है कि कुछ गड़बड़ है इसमें.
जी सर. So you have already explained the beta HCG.
Chorionic hormones and conditions with higher HCG level, T4 levels may be elevated with suppression of TSH, high greater affinity of the thyroid gland, TSH receptors. आगे वो चला, hormonal changes in genetics, family history, lower esophageal sphincter relaxes, वो reflux भी ज़्यादा होता है because of progestational effect. और estrogen, HCG, T4, TSH, so ये हो गया आगे polar pregnancy, hyperthyroidism, increased BMI, psychiatric illness. ये psychiatric illness पे खास तौर पे जरा नजर रखो चलो because generally वो कहा जाता है कि जी psychiatric illness वो इस तरह से you know वो one of my teachers was Professor Iqbal Rashid Mia. I worked with her as assistant professor also. Excellent lady, a very good surgeon and good gynecologist and excellent boss. But she once told that there was this woman who would have nausea, vomiting, and a lot of vomiting at home, but whenever she was admitted in the hospital, she would become all right. So one time she was admitted in the hospital and in a private room, and she started vomiting at that time. Again, so they couldn't understand what was the reason that usually when on her previous visit she was there in the hospital, she didn't have. But that time they found that somehow the picture of her mother-in-law was there in that room. So Professor Iqbal Rashid Mian's inference was that it was the picture of her mother-in-law which induced the vomiting. So she tactfully suggested to
Maybe that lead to her
and
psychiatric
so,
illness.
so that is what is meant by psychological influences which would require. But anyway, so आगे से
The classification of severity of nausea vomiting of pregnancy is quantified with pregnancy unique quantification of Emesis index, which scores from 0 to 15. And it includes the 3 questions. In the last 24 hours, for how long patient have felt nauseated or sick to your stomach? And second question is, in the last 24 hours, have you vomited or thrown up? For how many times? In last 24 hours, how many times you had retching or dry heaves due to without bringing up? These quantifies the nausea vomit severity of nausea vomiting of pregnancy in mild, moderate, and severe. Less than 6 is mild, 7 to 12 is moderate, and severe is 13 to 15. Management. Management of nausea vomiting of pregnancy includes the clinical assessment, which is history and examination, baseline investigations, differential diagnosis, and treatment. In history, we look if there is previous history of nausea vomiting of pregnancy or hyperemesis, and is it affecting the quality of life of the patient, and scoring on pregnancy unique quantification of emesis. Nausea and vomiting, hypersalivation, spitting, or loss of weight or inability to tolerate food or fluids, and its effect on quality of life. We will take the history to exclude the other causes like abdominal pain, which may be in cholecystitis or pancreatitis, and urinary symptoms, which can lead to urinary tract infections or any other viral or bacterial infections, or any history of drug intake, which can lead to nausea and vomiting, and chronic H. pylori infections. In examination, we will look for
signs of dehydration.
Investigations, which include baseline investigation, which includes the urine dipstick test, which quantifies the ketonuria as 1 plus or more due to dehydration, midstream urine test, urea and electrolytes, which can include in nausea and vomitings, which could be the hypokalemia, hyperkalemia, or hyponatremia, hypochloremia, or hypomagnesemia and hypocalcemia. Full blood count, in which the hematocrit, maybe hematocrit could be increased due to dehydration or any infection, anemia, and blood glucose monitoring to exclude the diabetic ketoacidosis. Ultrasound scan to confirm the viability of intrauterine pregnancy and to exclude the multiple pregnancy and any gestation trophoblastic disease. In refractory cases, we will look for the history of previous admissions and thyroid function test if she is hyperthyroid or not, and liver function test to exclude the other causes of nausea and vomiting like hepatitis or gallstones. And in acute pancreatitis, we will look for the amylase. And
यहाँ पे एक important चीज ये है कि this is a formidable list of tests and investigations. But at the same time, it ought to be remembered that even in examination, as well as being a good clinician, you just do not have a list of 25 tests that you would order and then look at them. That's bad practice, because that means that you have not been able to narrow down your diagnosis on clinical grounds, which generally you should be. So it will be extremely rare that you will require such large array of tests to be carried out. And therefore, you could say that these are the possible various, this is a long list of tests which may be relevant. But for example, pancreatitis, that presents in totally different way. Its pain, etc., is more severe, and that is in certain area which is a little distant from where the pregnancy is. So therefore, those diagnoses or those tests which are written like that should be separated from those which are more relevant. For example, if you want to have, say, serum electrolytes, you want to rule out certain infections, CBC, serum electrolytes, and urine complete examination, that will take care of most of the issues, which would be reasonably relevant to the situation. In addition, you could say that to rule out such other less likely diagnosis, other tests for, say, pancreatitis, etc., could be carried out. So you have to, in future, remember that in such cases, you will make two separate sets of investigations or other areas. One which will be reasonably relevant to that, would confirm or rule out, and the other which are that's a long list which may be yes, in those cases which are intact, right? So वो उसी तरह से जैसे कि PUO हो, तो PUO जब कोई आपके मलेरिया नहीं है, डायरेक्ट नहीं है, डेंगू नहीं है, फलानी है, तो फिर है, तो फिर then you go on to the second list. So it's important to keep that in mind, that even when you are appearing in examination and you are presenting your case, if you remember, say, all these conditions, 3, 6, 7, 13, 4, 17, and 5, 22. I said 25. So if you have these 22, 25 conditions, then you just name them quickly. I'll think very poorly of the candidate as an examiner. यही है ना, ये कुछ हो सकता है, वो बंदा कहेगा मैं तो जी सफेद काले कर दिए, मैंने तो लिख के इतनी थोड़ी वो कर दी, but that's all cross. So
these are the possible differentials of nausea vomiting.
हाँ, वो nausea vomiting की हैं, ये possible causes हैं. If we are talking of nausea vomiting even in pregnancy or not, अब appendicitis है, वो तो nausea vomiting of, we are talking of NVP, nausea vomiting of pregnancy, right? So that means कि वो इन चीजों में भी nausea vomiting होता है. चलो ये खुद ही बदल गई आगे.
नहीं सर, मैंने
अच्छा. No, it's important. Don't be embarrassed because of that slide. वो है slide है, but that emphasizes the fact. जो point हम बना रहे हैं वो आप खुद भी सोच रहे हो कि इतनी लंबी लिस्ट, उसको वो उसका एक छोटा सा वाक्य और सुना दूं. वो एक डॉक्टर साहब थे, वो MRCP वगैरह करके आए और बड़े मेथोडिकल और बड़े इस तरह से, तो वो प्राइवेट प्रैक्टिस क्लिनिक में करते यहाँ पे. तो एक पेशेंट आया कोई ओल्डर एज वाला, तो वो आया, तो वो डॉक्टर साहब के पास वक्त भी था, अभी इतनी प्रैक्टिस ज्यादा नहीं चली होगी, तो शुरू थे, तो उन्होंने उसका वो पूरी तरह से हिस्ट्री दी, फिर उन्होंने लिटा के उसका एग्जामिनेशन करना शुरू किया. आधा घंटा लगाया उन्होंने फुल एग्जामिनेशन करने के ऊपर. तो वो अभी एग्जामिनेशन का इख्तिताम नहीं उनका हुआ था, तो बाबा जी जो है ना वो उठ के बैठ गए. तो तो कहेंगे बाबा जी लेट, कहेंगे नहीं जी डॉक्टर साहब मैंने लगता कि ਤੁਹਾਨੂੰ मेरी बीमारी दी समझ नहीं आई, मैं चलिए।
नब्ज पकड़ के
तो
डॉक्टर
वो जो है वो इतना लंबा एग्जामिनेशन हो गया तो उन्होंने कहा कि ये तो काम गड़बड़ है। सो देयरफॉर ये लंबी लिस्ट जो है जब वो करने शुरू कर दो तो फिर वो इस तरह से
जी। In the treatment of nausea, vomiting of pregnancy, multidisciplinary team is involved. There are
डिसिप्लिनरी टीम में क्या कौन कौन होएगा?
as a dietitian, nutritionist, sometimes maybe endocrinologist, and midwives.
ये देखो आप ठीक है मल्टी डिसिप्लिनरी अप्रोच जो है नोजिया वॉमिटिंग के लिए जो करना है एसेंशियली आप ये करो कि जी इसमें मल्टी डिसिप्लिनरी अप्रोच सारे पेशेंट्स के लिए बोर्ड तो नहीं ना बैठाओगे आप।
जी सर।
A condition which is so common that you said that 80% of women or 70% of women during 70% of pregnant women experience some bit of nausea vomiting. Number one. Number two, the incidence of hyperemesis could be up to 3% of 3% of pregnancies. So which is quite common. You see, 3% is reasonably common. And for that, you multidisciplinary जो है वो हर जगह पे ऐसा नहीं। मल्टीडिसिप्लिनरी में क्या करोगे आप, मतलब वो डाइटिशियन ने कौन सी ऐसी बात बतानी है जो आप नहीं बता सकते हो? हैं? पहले खुद बताओ ना, डाइटिशियन ने क्या बतानी है कि आपने वो उसके लिए कौन सी डाइट बनाएगी कि उनको इस तरह से होगा। सो देयरफॉर के जी वो है इसके बारे में कहा जाता है कि नोजिया वॉमिटिंग की ट्रीटमेंट ऑफ प्रेगनेंसी और हाइपरएमेसिस की ट्रीटमेंट हो रही है। और मल्टी डिसिप्लिनरी अप्रोच में मुझे जरा इतराज था, मैंने कहा मल्टी डिसिप्लिनरी में क्या कुछ होगा वो उस पे है। चलो हाँ ठीक है ना। तो पहले आप कहो कि जी हम इस जो ट्रीटमेंट है वो क्या क्या होगी, और एंड में मल्टी डिसिप्लिनरी ये प्लेसेंटा एक्रीटा नहीं है। प्लेसेंटा एक्रीटा या कुछ और चीजें होती हैं कि जी मल्टी डिसिप्लिनरी उसमें हो तो वो ज्यादा बेहतर रिजल्ट्स हैं उनके कि वो आ जाएगा, सर्जन भी होगा, यूरोलॉजिस्ट भी होगा, पहले सारा प्लान करो तो वो उसकी
बजाय ये क्या कि दे शुड लुक फॉर अदर कॉजेज ऑफ वॉमिटिंग।
वो तो हो गया, वो सारा कुछ हो गया वो हुआ। तो उससे पहले आप उस तरह से चलो तो वो ये जाहिर है तुमने किसी किताब से ही लिखा है।
वो मैंने गाइडलाइन से किया था उसमें।
हाँ तो वो ही ना, वो उसको अगर आप वो फिर वो गाइडलाइन का ये मतलब नहीं है कि वो हरफे आखिरी है, उसमें कॉमन सेंस उसके साथ तो हम ऊपर नीचे उसको कर सकते हैं। सो ये जो एक्सरसाइज हम कर रहे हैं इसका मकसद यही है आपको ये समझाना कि गाइडलाइन में लिखा हुआ है, किताब में ये लिखा हुआ है, लेकिन हमने उसको प्रैक्टिस कैसे करना। अब वो आ गया नोजिया वोमिटिंग की पेशेंट आ गई, अब यहाँ पे भी तुम लोग करते हो, फौरन डॉक्टर अदर को बुला लो। खुद करने के बजाय कुछ के डॉक्टर अदर को हम वो आ जाते हैं, वो अपने वो एंटीबायोटिक दे के चले, वो तुम नहीं दे सकते हो।
हाइड्रेशन एंड
अब तुम लोगों ने शुरू कर दिया है कि जो आता है वो पेशेंट टेम्परेचर के साथ जो आती है ना पेशेंट, उनको रोसेफनी वो खुद ही लगा देते हैं, पहले वो लगा रहे होते हैं तो यही लगा देते हैं। अब यही हो गया ना,
जी सर।
तो उनको बुलाने के बजाय वो जो उन्होंने ट्रीटमेंट देनी हो। सो देयरफॉर यू सी देयर आर सर्टेन downsides to those that multidisciplinary approach, which is like shifting of responsibility to someone else. The problem primarily is ours, right? To handle. It is not our problem. It is the problem to be handled by us. Essentially, उसमें अगर आप देखो कि है आपको वो जो, और उसमें कौन सी ऐसी चीज है जो कि इसकी मैनेजमेंट में है, जो फिजिशियन करेंगे जो आप नहीं करोगे, जो डाइटिशियन करेगा जो आप नहीं करोगे, मिडवाइफ को भी साथ में तूने बुला लिया तो मिडवाइफ भी आ जाए, वो उनका सिस्टम हो रहा है।
साइकोथेरेपी का जिक्र हुआ है, साइकोथेरेपी एंड काउंसलिंग।
जी मैं
अब अभी तुम चुप रहना क्योंकि मैंने एंड में कुछ बोलना है।
अच्छा
चलो
तो बुलाया
नहीं मैं तुम्हें वो बुलाने के लिए वो हाँ साइकोथेरेपी मैं वो मैं तुम्हें बाद में
एक एग्जांपल भी दी थी।
हाँ चलो। एंटीबायोटिक स्टीरॉइड्स रिहाइड्रेशन ये मतलब ये ठीक है। अब इसमें इंपॉर्टेंट चीज जो आती है वो ये है कि एंटीबायोटिक कौन से दोगे और स्टीरॉइड्स का क्या रोल होगा, और रिहाइड्रेशन या वो उसकी इम्प्रूवमेंट ऑफ फ्लूइड मैनेजमेंट वो क्या होगा।
इलेक्ट्रोलाइट बैलेंस।
हाँ पार एंट्रल होता है, पार एंट्रल नहीं होता, पार एंट्रल फीडिंग। एंट्रल फीडिंग और पार एंट्रल फीडिंग इसमें क्या फर्क है?
Sir, enteral includes the nasogastric, nasojejunal or nasojejunal or gastrostomy, and parenteral feeding includes the PICC line, which is peripherally inserted central.
चलो, termination pregnancy, monitoring, discharge and follow. बस
नहीं sir, आगे लिखे. So these were the multi.
nurses, dietitian, pharmacist को क्या आगे करना, क्या करेंगे pharmacist? Endocrinologist, nutritionist, gastroenterologist, mental health team including psychiatrist. आगे non-pharmacological theories, ginger, acute stimulation, pharmacological, हाँ, acupressure, cyclism. हाँ, ये चीजें हैं, ये अब अभी हमारे पास हैं, हम यही देते हैं. ये इम्पोर्टेंट है कि आप ये दो और ब्रोमेथाजीन हाइड्रोक्लोराइड डोपामिन रिसेप्टर, ठीक है. मेटोक्लोप्रामाइड जो है ये इसके क्या डाउनसाइड क्या है? ठीक,
ऐसे एक्स्ट्रा पैरामीटर
एक्स्ट्रा पिरामिडल इफेक्ट्स होते हैं जब वो दो फिर उसका साथ दो.
थायमिन.
तो ये मुख्तलिफ है. ऑनडेंसेट्रॉन जो है ये मेरे लिए हमेशा टंग ट्विस्टर सा होता है. इसका इंडिकेशन कॉन्ट्रा इंडिकेशंस का वो भी देख लेना कि कितना करता है. इसीलिए वो जो इसका ऑनसेट बोलते हैं
जी सर,
ना,
ऑनसेट.
ऑनसेट तभी
कैटेगरी सी है.
जी सर, कैटेगरी सी है.
हाँ, मेरे जैसे नहीं किसी ने बनाया होगा
Yes.
ऑनसेट इसका,
Sir.
उसको ऑनडेंसेट्रॉन कहना जरा मुश्किल लगता होगा. हाँ.
So these are the some doses of these first line, second line, and third line therapies. The steroids which you were saying will give the hydrocortisone 100 milligram twice daily intravenous, and once clinical improvement occurs, we will taper it and convert to the prednisolone 40 to 50 milligram daily per oral, with the dose gradually tapering until the lowest maintenance dose achieves.
ये कौन सी गाइडलाइंस में से?
Sir, nice.
Nice.
So last
एक्चुअली मेरा
August
था
2021.
हम के जो स्टीरॉइड्स है उसको प्रॉपर्ली यूज करते हैं.
ये आरसीओ की गाइडलाइन है ना.
इसलिए जब आप मल्टी डिसिप्लिनरी वालों को बुलाते हैं तो
वो करते हैं
डिफरेंस
सर.
दैट दे मेक टू द मैनेजमेंट इज
Steroid.
क्योंकि बाकी ये सारी चीजें आप ले
सर,
सकते
हम
हो.
देते हैं.
अच्छा, अब इसमें इम्पोर्टेंट चीज जो है ना, ये आपने वो लिख दी, क्योंकि आमतौर पे जो प्रेपरेशंस होती हैं जैसे ये एनवीपी है या
जी, सर.
वो दूसरी कौन सी थी?
Onset या
नहीं ऑनसेट नहीं है, लेविडॉक्सिन जो है
नेविडॉक्सिन
वो साइक्लिसिन और वो B12 और B6 उसमें होती है. वो एसेंशियली वो उसके लिए होती है. लेकिन इनके जो है जैसे क्लोरप्रोमाजीन है, इट्स गॉट सम प्रॉब्लम्स विद लिवर. इसका लिवर का डिसफंक्शन होता है जब आप देते हो तो, और लंबे अरसे के लिए आप दे नहीं सकते, because this is going to be a longish treatment.
जी.
It is not going to be कि आप 2 दिन 4 दिन दे दोगे तो वो ठीक हो जाएगी. The woman has to take that treatment for a longer period of time, and sometimes it continues beyond first trimester. So हमने कहीं पे emphasize ये नहीं किया, लगता है कि usually in most of the women nausea vomiting of pregnancy abates around 13-14 weeks, and the rest of the
Around
pregnancy is generally uneventful. But in some it persists and it continues to
Till
be in
delivery.
severer form, और वो उस तरह से वो hyperemesis वाले जो वो वाली
जी.
बात होती है. इसी तरह से जब आप सेकंड लाइन में आपको क्लोरप्रोमाजीन के कितना देना है और उसके कितने, ये जरा नोट करो, अपने सवाल लिखो
जी.
इसके कि ये प्रोक्लोरपेराजीन या प्रोमेथाजीन और क्लोरप्रोमाजीन जो है, क्लोरोमाजीन कौन सी, क्लोरप्रोमाजीन नहीं, वो जो लार्जेक्टर होती थी, क्लोरमाजीन.
सर, क्लोरप्रोमाजीन.
ये क्लोरप्रोमाजीन है, स्पेलिंग गलत है, क्लोरप्रोमाजीन होगी. तो ये इनके आप देखोगे कि इनके साइड इफेक्ट्स क्या हैं, और खास तौर पे इफ यू एडमिनिस्टर देम फॉर मोर देन अ फ्यू डेज, और वो क्या क्या इनके हो सकते हैं. इसी तरह से ये क्लोप्रामाइड जो है ये हम आम प्रैक्टिस में इस्तेमाल नहीं करते,
जी सर.
again because of extrapyramidal symptoms, because again if it's a question of 1, 2 or 3 doses or say a few days, then it will be all right, but giving it for a longer period of time, what would be the implications? ये मुझे आप ये देख के बताओगे.
जी सर.
और कार्टिकोस्टेरॉइड्स उनकी डाउनसाइड क्या है कि आप 100 मिलीग्राम ट्वाइस दे रहे हो डेली इंट्रावीनस, और वो भी इम्पोर्टेंट है कि आप उसको कंट्रोल करो सिम्टम्स को, लेकिन उनकी क्या क्या चीजें हो सकती हैं. ठीक है, और आप इसके आगे.
Sir, these were the some side effects which you were talking about. Onset specifically in some cases causes cleft lip or palate or heart problems.
ठीक है, ये इम्पोर्टेंट है, ये सारे ये वाली चीजें
जी
ये देखें, ये वाला टेबल जो है आपने अच्छा
इसको देख के लगता है कि जैसे ऑनसेट नहीं
जी।
देना चाहिए।
हाँ, वो जनरली वो होता है कि मॉडरेट लो क्वालिटी एविडेंस क्लेफ्ट लिप पैलेट, इसका भी है, स्टीरॉइड्स का भी ये होगा, जब आप देना शुरू करते हो तो उसमें भी ये वाली चीजें आ सकती हैं, तो इसलिए ऑनसेट जो है वो
for some
खासतौर पर
specific days का सर बोले,
हम्म,
not for longer use.
हम्म,
In rehydration regime, normal saline should be given with additional potassium chloride according to the serum electrolytes of the patient, which we will do in inpatients daily. And dextrose and fuel are not appropriate unless there is serum sodium levels are normal and thiamine has been administered, because they will precipitate the warning encephalopathy. This is the complete management of the patient with the nausea vomiting of pregnancy, which includes the initial assessment to exclude the other causes, and then scoring. According to the score, we will give the treatment to the patient. If the score is 3 to 12, we will give the antiemetics to the patient and lifestyle and dietary changes. And if the score is below 13, but patient is non-compliant and patient is having no complication or no refractory to antiemetics, then we will give the ambulatory daycare, which includes the fast intravenous hydration with normal saline and potassium and antiemetics and thiamine. And with the patients having score more than 13 or with complication and with unsuccessful ambulatory daycare, we will give the inpatient management, which includes the routine ambulatory daycare and the thromboprophylaxis for the days in which the patient is admitted in the hospital, and on discharge we will discontinue low molecular weight heparin, and we will consider the steroids. Sir, ये वही था दुआ।
वही, अच्छा इसमें एक एंड में वो भी होना चाहिए कि व्हेन यू डिस्चार्ज द पेशेंट, बिकॉज आपने थ्रोम्बोप्रोफिलैक्सिस की बात की है, लिमिटेशन फिजिकल एक्टिविटी है उसमें, तो वो डिस्चार्ज के टाइम की जो एडवाइस है वो भी इसमें इंक्लूड करनी चाहिए, बिकॉज ये ना हो कि घर जाके वो हाउ इम्पोर्टेंट इट इज टू बी अप एंड अबाउट एंड टू बी मूविंग, and just in case that if it becomes worse again, then she should come to the hospital, because she'll have to make visits to the hospital. Or bus?
नहीं sir, sir ये वही था। This is very rare in if all the therapeutic managements is failed, and then we will advise the termination of unwanted pregnancy.
मेरे ख्याल में इसमें कुछ मॉडिफाई करने की जरूरत है टर्मिनेशन को, तो मैं खाली थेरेप्यूटिक मेजर्स की बात नहीं है, इसमें ये कि अगर पेशेंट का वेट लॉस हो रहा है, आपने थेरेप्यूटिक मेजर्स दिए, पेशेंट का वेट लॉस हो रहा है, शी इज इन नेगेटिव बैलेंस एंड शी इज विलिंग, देन ओनली यू शुड टॉक। मतलब ये काफी इसको कुछ कह के फिर टर्मिनेशन का लफ्ज आता।
ठीक है,
जी sir, during inpatient management, we will monitor the serum electrolytes and avoid the iron content preparation, as they will increase the nausea and vomiting, and we will give the thiamine supplementation. And on discharge, we will advise the patient to come back if the symptoms reoccurs, and continue their antiemetics, and they should know how to assess for further management if silent symptoms reoccur, and early treatment may reduce her need for hospital admissions. There are 15% risk of reoccurrence in future pregnancies for the patients which have the nausea vomiting of pregnancy or hyperemesis in index pregnancy, and early use of lifestyle modification or dietary modification and antiemetics were found to be useful in the previous pregnancies, is advised to the patient to take in the next pregnancy to reduce the risk of hyperemesis. जी सर, वो गलत है।
तो मैंने इसकी पूरी,
शुरू में कहा था सर।
चलो हाँ जी, अब मैं जरा थोड़ी सी मैं भी गुजारिश कर दूं।
सर है 50 नहीं सर, 12 minutes बैक।
हाँ 12 मिनट्स है।
तो मतलब ये है कि आप 10 मिनट
नहीं सर ने कहा था 15 मिनट्स मुझे देने।
एक्चुअली 15 मिनट से ज्यादा हो सकता है, पर चलो मैं 15 मिनट्स भी चल जाऊंगा। ये स्क्रीन स्क्रीन शेयर मैं करने लगा हूँ। दिस विल स्टॉप अगर यस कंटिन्यू। ओके, ये आई नहीं अभी।
सर की स्क्रीन शेयर करनी।
This is something which I just made in the morning. थोड़ा सा मैं लेट इसलिए भी हो। This is a paper which came on 13th of December 2023, and it was published in the journal Nature. And it says that GDF15 linked to maternal risk of nausea and vomiting during pregnancy. GDF is growth differential factor 15, which is a hormone acting on the brainstem, has been implicated in the nausea and vomiting of pregnancy, including its most severe form, hyperemesis, but a full mechanism understanding is lacking. ये अभी आया है, ये 13th of December को पेपर, और Cambridge University से निकला, and the countries which were involved in that were UK, US, Denmark, and Sri Lanka. Why 7 in 10 women experience pregnancy? This is Cambridge University's. And this again study finds causes and potential prevention of pregnancy sickness. And the culprit is a hormone produced by the fetus, a protein known as growth differential factor 15. Or combination of how much of the hormone is there. Or then 7 in 10 pregnancies are affected by nausea, vomiting. Between 1 and 3 in 100 pregnancies, severe commonest cause of admission to hospital. Then some therapies exist to treat pregnancy sickness, at least partially effective, but widespread ignorance of the disorder compounded by fear of using medication in pregnancy, because we don't want to use many medicines which may be harmful for the fetus. So the important thing is that might relate to the production by the placenta of the hormone. The hormone acts on the mother's brain to cause her to feel nauseous and vomit. The researchers showed that the degree of nausea and vomiting that a woman experiences in pregnancy is directly related to the amount of GDF15 made by the fetal part of the placenta and sent into her bloodstream, and also how sensitive she is to nauseating effect of this hormone. It's made at low levels in all tissues outside of pregnancy. It is actually presented, but those women who normally have low levels of GDF15 in blood have a higher risk of developing severe nausea and vomiting in pregnancy. And this team, which was researching, found that a rare genetic variant that puts women at a much greater risk of hyperemesis are associated with lower levels of hormones. So that is the genetic basis. And similarly, women with inherited thalassemia, beta thalassemia, they have high levels of GDF15 and they do not experience the hyperemesis. The researchers believe that building up women's tolerance to the hormone prior to pregnancy could hold the key to preventing sickness. अब यहाँ पे एक co-author है, इसमें emphasis जो है वो GDF15 पे, that's what I wanted to say here. This is the author Marlena Fajo. Marlena Fajo वो जो थी, अब मैं इसमें थोड़ी सी स्क्रीन और शेयर करूंगा. All right.
My question is कि GDF15 की अगर लेवल लो है तब nausea होगा
नहीं ज्यादा.
या हाई है तब
High
nausea
or sensitivity to that. Actually, that's important.
प्रीवियसली सर वो कहा था ना जिन
अब
वुमेन्स में
हाँ, अब ये है, ये पेपर था जो एक्चुअली आया था, ये GDF लिंक टू मैटरनल, ये उसका जो है एब्स्ट्रैक्ट है उस पेपर का. लेकिन जो चीज एक दो चीजें वो जो मैंने पहले बता दिया मोर और लेस वही है इसमें चीजें. लेकिन कुछ चीजें जो मैं और इसमें बताना चाह रहा था वो those are important in the sense कि ये एक वो जो साइकोलॉजिकल वाली बात आती है ना, उसमें ये वाली चीज एक है कि ये जो मार्लिन फेजो, she was pregnant, she was a geneticist, she had worked in Harvard, and in 99 in her second in 96 she had her first pregnancy, and in that she experienced extreme nausea and vomiting, but that became all right. This story is something which is important to read. तो ये उसका हुआ, उसके बाद सेकंड प्रेगनेंसी जो थी, it was so bad that she had to have termination of pregnancy. That was in 99. And not in this, but in another story, it came. This story was published by New York Times in ये नहीं ये आई थी मई में जब मैंने दिया तो ये मार्च 14 के उसमें आई. So this was actually before the findings of the study came out. So then she, from 99 onwards, she started working on this, that there must be some reason. और ये उसकी स्टोरी है कि किस तरीके से उसने ये कहाँ से उसने रिसर्च की. वो कि that her doctor would blame her suffering on her own psyche, infuriated Dr. Fedros. She made it her life's work to find the condition's true cause. 99 से इसने काम शुरू किया. ये मैंने कुछ थोड़ा सा इसमें highlight किए. As a graduate student at Harvard, discovered 2 genes involved in the development of uterine fibroid because she was working on genetics. उसके बाद ये इसने hyperemesis gravidarum शुरू की थी. And then यहाँ पे मैंने हाईलाइट किया हुआ है कि before IV fluid, ये important है, ये जो जिस तरह से अभी बात हो रही है, it became routinely available in 1900s. Hyperemesis killed pregnant women often enough that medical literature listed excessive vomiting as a reason to induce abortion because of the danger it posed to the mother's life. So it was so important. As a matter of fact, Charlotte Bronte, इसकी किताब किसी को पता? हाँ? Wuthering Heights इसकी बहन की किताब है.
Oh, Jane Eyre.
हाँ, Jane Eyre.
कौन बोला है?
हाँ?
पढ़ा लिखा शख्स से
हाँ, Wuthering Heights जो है उसकी
Emily here.
दूसरी बहन की है.
I love that.
So electrolyte imbalances caused by excessive vomiting can bring about heart arrhythmias, cardiac arrest, malnutrition, deficiency in vitamin B, thiamine can lead to ये पढ़ो उस लिहाज से बनने. So this is relevant in that. So and then she carried out a study. इसको मिला वो funds नहीं मिल रहे थे, फिर इसने किसी तरीके से और हुआ, फिर इसने ये एक कंपनी के साथ collaborate किया, and then it took her about 20 years to come to that conclusion, and finally she was part of that study, which was spearheaded by Cambridge University, and then they found that this particular factor, GDF15, was responsible for nausea and vomiting. And this is how they came to GDF acts in a part of the brainstem that suppresses appetite and sets off vomiting. ये है brainstem में इसका effect होता है. And this study इन्होंने पहले publish की, confirmed the link between hyperemesis and GDF15 in the patients. She had enrolled over a decade of on Fridays को ये करती थी वो इस तरह से. So that was published in 2022, and then finally this study came in December 23. ठीक? So this story is worth reading, and this is again extreme morning sickness. ये तो वही उसकी scientists finally pinpoint a possible cause. Now they'll be working on this, that what is something that will sensitize or desensitize women to GDF15's effect, or GDF15's effect on the brainstem. So there are 2 ways forward which will let us know how we go about it. So I'm going to put these 2 stories also onto your group, so you can study that.
Excellent.
Yes, sir. ठीक है?
जी
So that does not mean that what you said has become irrelevant. That's very much relevant because that is the current way of our management and treatment of this, and this is how we are doing it. But at the same time,
this is the
you
recent-
need to be aware of
जो
this.
वाइवा में 5 नंबर होते हैं ना रिसेंट एडवांसेस के लिए
अभी एक महीना नहीं हुआ स्टडी को आए
जी,
हुए।
sir,
हाँ ठीक है,
December.
ओके जी। डॉक्टर साहब आए थे?
जी sir.
ओ,
गुड मॉर्निंग सर।
अस्सलाम वालेकुम जी।
अस्सलाम वालेकुम sir.
सामने को
ओ रुबीना भी है
इस कैसे
और साढ़े लिए दुआ मंगी सी।
बिल्कुल मांगी थी
हम
दुआ
तो
करनी थी।
हाँ हम तो मज़ारों पे नहीं जाते,
कोई बात नहीं दुआ तो फिर भी हो सकती
कहीं भी हो सकती।
नहीं डॉक्टर साहब पूछा है इंडिविजुअल नहीं मांगी
है।
थी।
बिल्कुल मांगी थी
हाँ मतलब इज्तिमाई दुआ में तुम
मैं इज्तिमाई दुआ का ये
नहीं, मतलब है, मैं तो-
आई हैव टू एक्सप्लेन। तो हम सारे बहन भाई थे तो हमने ये किया था, हम कहते थे कि दुआएं तो मिलती जुलती हैं तो एक ही करवा दो, तो मैं करवाती थी और उसमें आपका तलतापा का बच्चों का हर एक का नाम लेके ऐसे ही
ठीक
चलो थैंक यू
मोस्ट वेलकम।
यार।
चलो राइट
तो-
सर।
शैले से के हॉलीडे के बाद रिफ्रेश होके आ गई हो।
हाँ आई एम रिफ्रेश, इट वाज एन इंटरेस्टिंग एक्सपीरियंस और मेरे ख्याल में हम इतनी जगह टूरिज्म करते हैं तो इवन फ्रॉम दैट पर्सपेक्टिव इट वाज वेरी इंटरेस्टिंग, देयर इज लॉट टू अच्छा था
गुड।
सर, कोशिश करें मैं कुछ ना
चल